President Trump cruises to victory with a record-breaking Republican turnout.
Trump got more total votes than Obama got as an incumbent.
Republican turnout operation in Texas is extraordinary.
Complete domination.
Receiving more primary votes than any sitting president.
We're winning. We're winning all over.
We had record turnout for an incumbent president.
The Republican Party has never been unified like it is now.
Turnout was also huge for Donald Trump.
President Trump celebrating a record-breaking victory.
It's not even a party, it's a movement.
More than President Obama had by a wide margin.
Let's realize how good Donald Trump's political operation is.
To all Americans tonight, I'm with you, the American people. I am with you, I will fight for you, and I will win for you. And we are going to keep America great.
Hi, everyone. Welcome to American Heroes. I am so excited for what we have in store for you today. We are going to talk to some incredible Americans out on the front lines, keeping the economy moving, facing coronavirus face-to-face in our hospitals and our nursing homes. I'm very excited about this episode. You'll want to stay tuned the entire time. Joining us now, I'm particularly excited about these two guests, is Dr. Robin Armstrong, who practices internal medicine in Texas, and Steve Frisbee, a paramedic and the director of operations at Life Care Ambulance Services in Michigan. Thank you both so much.
Thanks for having us.
Yeah, I want to start with you, Dr. Armstrong. You're facing coronavirus head on in our hospitals and ICU. Tell me what you've seen.
Well, what we've seen in our hospital is here in Texas, there's been an uptick in the number of cases that we've seen. Our curve is a little bit behind New York. And so what we've seen is here lately in the last few days, the patients that are coming in are a lot sicker than what we've seen previously. Before we were having lots of positive COVID-19 cases, and those folks were, for the most part, people that we were seeing in the emergency department and discharging to home, not even admitting to the hospital, just having them quarantine in place at home. But now we're starting to see patients that are having more respiratory distress, more oxygen requirements. We're having to admit them to the hospital. We've got ventilated patients now, and we also have some patients that are getting better as well. So we've had a few patients we've sent home. We've requiring high oxygen flows, up to 7 liters of oxygen, which is quite a bit of oxygen, and then we've been able to treat them with the medications, the hydroxychloroquine and azithromycin, and some of them have gotten better. Some of them are still hospitalized, but some have gotten better. So that's what we're seeing in Texas.
Yeah, and you also mentioned to me a nursing home that you're working in that has had more than 50 coronavirus positives. That is very worrisome to me as someone who, is watching the news and seeing how this affects the elderly. What are you doing there to try to protect these vulnerable Americans?
So what we've done is we have, it was a bit of a shock to us that this happened, but started off with a physical therapy assistant that was positive, and then it just spread from there. What we're doing as a practice is we're ordering personal protective equipment ourselves, and because we have to protect our staff, and so we're ordering that, and our plan is to go into the nursing home actually starting today. Soon after I'm done with this interview, we're going to go in and we're going to manage those patients. We're going to check oxygen saturations very closely. And what we're trying to do is something that really hasn't been done in the country so far, is we're trying to make sure that we follow their oxygen saturations closely. So when we see that they're having increased oxygen requirements, our plan is to start treating them with the hydroxychloroquine and with the azithromycin. And so that is what we're going to try to do right now. We're still trying to get those medications in. And so we're working on it with our government officials here in Texas that have been very helpful. And so it looks like we're going to be able to get the medications that we need and then treat these patients. And so that is our plan and our goal. and we're going to start that very soon. And so we're going to be following them daily, with our goal being to keep them out of the hospital, because we all know that the hospital is the worst place where we want these elderly folks. And the studies have shown thus far is that when the elderly people start getting very sick, then it's almost too late to treat them. And so by the time they go into the hospital, then the morbidity and mortality is very high. And so our goal is to keep them out of the hospital, treat them in the nursing home, and then make sure that we can keep them and take care of them there.
Wow, what a proactive, novel approach. That makes a ton of sense to me. What a good idea. Thank you so much for sharing that with our viewers. You know, Steve, yeah, that was great. Steve, you oversee a number of paramedics who are on the front lines facing COVID-19. You're a paramedic yourself. What's it like right now for a paramedic facing COVID-19?
Well, when it first started, everybody was a little bit afraid because we didn't know about, what to do. Once a paramedic or an EMT knows how to protect themselves, they're pretty good with being able to operate in any environment and confidently. As long as they have the PPE, which is always a worry, do we have enough? We do currently, but for the long term, we've got to take some actions. But a lot of ingenuity going around the country, I think, is going to help us. So we look forward to that. But there's a lot of that. We're humans too, and we're worried about taking it home to our family and those kind of things. And we have a nursing home here in Michigan, and in where we service that was the first break, one of the first few patients that we had, and our first death yesterday in Calhoun County. So what they're doing in Arizona, what the doc just talked about, is a pretty cool idea, and really aggressively managing people in place. And that may have some great benefit across the country where it will work. So thanks for bringing that up.
Absolutely. I can't imagine being a paramedic right now and, going to a house that might have multiple people infected with coronavirus and having to go in, not knowing what you're about to face. And it just takes a lot of courage for both you and for Dr. Armstrong as well. And what kind of protective steps, Steve, would a paramedic take right now to ensure they're protecting themselves and their families?
Well, it starts at the call, and 911 is asking the questions. They're called COVID questions now, and about any fever, sore throat, cough, anything like that that's going on, and we kind of protect ourselves that way on the way in. We don't approach the scene like we used to. We used to get there, look around, and say, okay, we always assess scene safety. You can't see COVID, right? And that's one of the things that has made EMTs and paramedics change how they do things. And you engage a patient from farther away to say, what's going on? How can I help you? Look for those life threats right away, but standing back and then making sure that a patient gets a mask put on them, and we're determining based on the answer to those questions, how are we going to, what level do we need to go to treat ourselves in PPE?
That makes sense. And, as President Trump said, it's the invisible enemy that we're facing. And that's so true. Dr. Armstrong, what are your thoughts on President Trump's response to the coronavirus from a medical perspective?
So from a medical perspective, I think President Trump has done about everything that you can do. I think, scientifically, to closing the borders and closing travel from China was just huge in giving us medical professionals time to gear up for what was going to be for what is coming now. So had he not done that very early on, then I think we'd probably be in a lot worse shape now, and the situation would just be a lot worse now. That was huge for us. I really appreciate the way that as a businessman, he really is using those skills to bring business interests together, to bring the government together, to bring all these different various groups together to work to try and to accomplish the goal of conquering this COVID-19 virus. And so I think he's very much in his element, bringing all these various different groups together, working together and coming together to work as Americans to accomplish this goal. And so I really appreciate that, because it's going to take an entire effort, all hands on deck. everybody working together to try and defeat this. And I appreciate the fact that he's been able to work with the governor of California, the governor of New York, the governor of Texas, Republican governor, Democrat governor. He's been able to work with all different types of people in different professions and he's been able to organize and lead this entire effort, which I think is probably one of the biggest efforts that have ever come together before. It's pretty amazing. And so as a medical professional, as a scientist, I really appreciate the work that he's done. I think it's been huge. And I think that because of that, I mean, we're farther ahead of where we would have been otherwise.
That's right. And you hit the nail on the head talking about bringing in industry. Before there was legislation providing free coronavirus testing, President Trump had already secured that with many of the big insurance companies. He's ensured that, companies like Blue Cross Blue Shield and many others are waiving copays for coronavirus treatment. So that's big. Steve, what are your thoughts on President Trump's response?
Well, I think I agree with the doctor. I think he's doing everything he knows to do. And I think he's got a great team assembled around him. And what I see of Dr. Fauci and others and what they bring to the table is amazing. Fauci's been around for forever and led many efforts. This is different than anything we've ever faced before. EMS and physicians, we're used to dealing with a situation that lasts a few hours, a few days, and we pick up the pieces and move along. This thing's going to last a long, long time. So you're in that constant state of readiness. So it's different. And I think that's what President Trump has figured out, that this is a long-term thing. And he got that from the get-go. And he's going to put things in place to help us get through the long term. But there's short-term crisis issues that he's dealing with, getting people PPE when they need it, getting them ventilators, getting people to other industry like GM and the UAW and Ford and all those folks to figure out how to retool quickly to do something to meet the needs of healthcare and the citizens. So what I think Donald Trump will learn is that he learns a lesson all the time. And he always puts it into practice moving forward. So this country was not prepared for a pandemic. We've always prepared for events that are shorter term. So I don't think anybody really realized how long this could last ever. We've practiced them, we've talked about them, but we've never had to do it. So I think everybody's learning a lesson, including Donald Trump, in a good way for the future. And he's reacting on how to get those shortages cleared up as quick as he can, and I appreciate that.
Yeah, we know that President Obama left the stockpile empty, and Vice President Joe Biden of those N95 respirators. It was never replenished, and yeah, we haven't faced anything like this since 1917, actually. Dr. Armstrong, for you, do you see optimism and hope for hydroxychloroquine and zithromycin?
I do. There certainly are not studies that have proven anything yet, but right now it's all we have right now. There are some other antiretrovirals. Remdesivir is one. It's IV. It's what's used to treat Ebola. We've got some other HIV medications that are being experimented with, but right now hydroxychloroquine and azithromycin are the only thing we have. Now, I have treated patients with this. And those patients that I have treated with those medications have actually gotten better. One was a young man, he's 41 years old, in the ICU, and we treated him with it. He was having very high oxygen requirements. Fortunately, he did not need to be intubated, but he was on the medication and actually got better, and we eventually sent him home. And so he did get better, but I'm not sure that it was the medicine or whether he would have gotten better on his own. So I think right now what we have to do is just continue to do the studies. Right now as physicians and as paramedics and as medical professionals, we treat with what we have. And I do know that the side effect profile of hydroxychloroquine and azithromycin is low. And so since that's what we have right now, and there have been anecdotal reports that it can be successful, then we're going to use that. We're going to use it and try it. And I think that as we're able to acquire these medications for this one nursing home where everyone was tested, I think that'll give us some good information going forward and see if it's able to keep these folks out of the hospital. So I'm excited to take care of these folks and make sure that because keeping them out of the hospital is by far the best thing. I think families understand that, and certainly the healthcare professionals understand that, because our hospitals now are being overrun as well. And so we need to keep them in place and treat them there.
Absolutely. Dr. Armstrong, that just a lot of brilliant solutions coming from you. It's the first time we've met. But Steve, you actually sent a picture to my sister who pre-interviewed you for this segment. Apparently you and I took a picture at one of the rallies together, and it's great. Those were good times. We hope we get back to where we can have those large social gatherings. It's really great to see you again, Steve and Dr. Armstrong. Thank you both. You're out on the front lines. You're facing the coronavirus, and it's got to be scary. I can imagine it. And we just truly appreciate you. You are our American heroes.
Thank you very much.
Thank you, guys, and stay tuned to American Heroes. Coming up next, you won't want to miss it.
Ready to go?
This is a crisis.
This is no time for Donald Trump's record of hysterical xenophobia.
Biden's son inked a $1 billion deal with a subsidiary of the Bank of China.
China is going to eat our lunch? Come on, man. They're not bad folks.
Since the outbreak, the Communist Party has been mobilizing overseas organizations to buy local supplies and send them to China.
It is in our self-interest that China continue to prosper. What a beautiful history we wrote together. Banning all travel will not stop it.
Travel ban that he slapped on China, every doctor now acknowledges was the right move. That was a very smart move right there.
Hysterical xenophobia. Jeremiah. Xenophobia. I complimented him on dealing with China. I'm not going nuts.
Welcome back to American Heroes. Joining me now are two of our heroes, our valiant law enforcement officers. Ed Dura, he's a 30-year veteran of the Woonsocket Police Department in Rhode Island and a lieutenant and officer in charge of the day uniform platoon. Also, Sheriff Richard Jones, who's been in law enforcement for 46 years. He's been an administrator of the Butler County Sheriff's Office for over 20 years. Thank you both for joining me.
Thank you.
Glad to be here.
Thanks. So, Ed, I want to start with you. You're working with the mayor on doing some pretty impressive and heartwarming things in your community. Tell us about what you and your officers are doing.
Well, since the crisis has started, we've had to change the way we operate. A lot of what we're doing now is online reporting for non-emergency calls for service. There's screening of calls through FEMA guidelines. When people call the police department, we ask them if they're coughing, flu-like symptoms, etc. And when we go to the calls now, if possible, we ask them to come out and meet us outside. So we're doing social distancing, practicing that. FEMA has also provided us with N95 masks and surgical masks and PPE equipment. So we have that if necessary. So we also received a $140,000 grant from the federal government. And with that, we have increased bike patrols to check the parks, common areas within the community, make sure people are practicing the guidelines. We also have directed patrols, checking commercial establishments, ensuring that in our state, 20% of the capacity of the business for people inside the business is what they're maintaining and have an account.
That's great. I'm so glad to hear that you guys are taking the necessary precautions, but you're working with the mayor on something involving saluting our healthcare heroes, which I think is particularly great, and haircuts and deliveries. What are you doing for senior citizens, for the healthcare community, our heroes?
Well, that too. We have community partners with the Rhode Island Food Bank, Aging Well Senior Services, etc. And together we have delivered supplemental food, groceries, and items, paper goods to the senior citizens where a lot of them are shut in and can't get out during this pandemic. We also have an event we're working on in the next day or so where we're going to go to our local hospital and have the police officers line their vehicles up, stand outside at the change of shifts to salute the healthcare professionals and employees at the hospital as they arrive and depart that day for work.
That's amazing. I love that. You know, here where I live, there are signs everywhere saluting our healthcare heroes. You drive into my neighborhood, there's a big sign because there's a hospital nearby, thanking them for what they're doing. And it's incredible to see one group of heroes, our law enforcement officers, doing the same for another group of heroes, our healthcare workers. Sheriff Jones, going to you. First of all, I love that you always wear a cowboy hat on during your interviews. It's really great. I love that. But you know, what are you guys doing? Your officers. You oversee 500 officers, 1,000 prisoners. What are you guys doing, the officers in particular, to help the community?
We have 400,000 people from this county. We're the 8th largest county in Ohio. What we're trying to do is keep our officers healthy, for one. We've had several that were tested or had symptoms and they were off work. We have 1,000 prisoners, which is very difficult. We try to keep this illness out of the jail. Here in Ohio, the sheriffs operate the jail full service. We've got people out in the community. We're knocking on doors. We're still serving papers. We're still fighting crime. Crime's down a little, but we still have car crashes we respond to. We still have people that are injured. We still have people robbing people. We still have drug dealers selling drugs. The liquor stores are still open in Ohio. I had one lady that called me and said she's afraid her liver is going to shut down if this doesn't get lifted pretty soon. She's drank so much whiskey and alcohol. So she had a sense of humor. But what we've been trying to do is, in the beginning, like I was saying, we had to scrounge our own equipment, the PPEs, the protection equipment for the employees. And in the beginning, you have to do that all on your own. So we were all caught off guard with this. So we started scrounging our mask, and we asked the public to donate masks to our office, which people were bringing the N95 mask. They were bringing the PPEs, which are people that paint cars. They have these, and they were giving them to us, just donating them to us. The hand sanitizer, we have a local company that's doing that. I just went through all the jails this morning before I came on with you guys. I go back, I see the prisoners, I see the officers. And we're just trying to keep it from coming in our jail and keep our employees healthy and safe to when they knock on a door, they go home at night and they don't take this illness to their homes. Plus, we're fighting crime.
You know, Ed, from a first responder standpoint, what do you think of President Trump's coronavirus response?
Well, I think from the very beginning, President Trump has been decisive to combat this, and he's the travel bans, giving hospitals what they need. Also, steps to shore up the economy. We've seen that locally. The effects are just starting to take effect here as far as the applications for the payroll protection program. There's also unemployment benefits have been extended. So I think he's working tirelessly. He's working really hard, and he's trying to get the job done for the American people.
Absolutely. That's exactly right. This president's taken early and bold action. What about you, Sheriff Jones? What do you think of the president's response?
I think it's been great. He surrounds himself with the smartest people in the world. And when he has his press conferences, the vice president, he's put in charge of this, which is a great vice president. They're on every day. They get up, they take their different times talking, answering questions, and they're not easy questions. And he's got a room, I assume when this is all done, they talk about it every day. It changes every hour, and he's not sugarcoated anything. He's told us to expect the worst. He's not told us that it's going to be great and wonderful. And so we've prepared for the worst. And if it gets better, that's great. And we know there's going to be sun at the end of the day. But when you listen, he tells it like it is. His people tell it like it is. And when you get to trust and believe your leader like he does, it's not always pleasant. It's like when my mom would say, this is going to hurt me more than it does you. I never looked at it that way. But he is absolutely correct. And at first responders, he's been our hero. He loves the police. He loves the fire. He loves the people in the medical field. He praises them every day, even when there's not a pandemic. So it's great to have him as our leader. I feel very comfortable and proud to have him.
Very well said, Sheriff.
Very well said, absolutely. And Ed, you have a personal story with the president from 30 years ago. Could you share with our viewers your interaction with him from 3 decades ago?
Yeah, it was a little over 30 years ago. I was probably young and dumb with my friends. We went down to Atlantic City, and we happened to stumble into him on the boardwalk. And he had 2 security officers with him. He was getting ready to head out for the night, I guess. And but he took the time to chat with us for a few minutes, actually. And I told him basically, we're really impressed with everything he's done so far in New York. We also told him, so I could see him as a presidential candidate someday. He goes, well, not this very minute, but he goes, if I ever decide, will you be with me? And I said, absolutely. And then a little over 30 years later, I saw him on the rope line in Worcester, Mass. at one of his first rallies and reminded him of it. I'm sure he ran into a lot of people over that time. He didn't remember the story, but he was very gracious. I told him I was going to run as a delegate. He says, you do that. And then he came over and signed my shirt.
That is so fantastic. And, I love that because I was in Las Vegas and I go out through the crowd. I talk to the men and women who come to the Trump rallies. And one woman told me, I met the president 20 years ago in Las Vegas and he was so nice and he took the time with me and so did the first lady. And just really neat to hear that that's the kind of person he is. And we all know that. I know that to be true. And it's great to hear that from someone else. Sheriff Jones, last word to you. What do you want to leave the American people with as, we think about your officers and hold them close to our heart?
We need to pray for our leadership, pray for the president, pray for the vice president, pray for the first responders, the people in these hospitals, these nurses, the doctors. We need to pray for the country and pray that we get this all under control and we get back to work. And that's my last words.
Well, that's great. Thank you both. You are our heroes. Stay safe. We so appreciate you. Coming up next, more American Heroes.
In times of struggle, we see the true greatness of the American character. Americans from all walks of life are rallying together to defeat the unseen enemy.
The president is talking about hope for people.
The president's been working nonstop.
The president has demonstrated excellent, bold leadership.
He said everything that I could have hoped for.
He is being the kind of leader that people need.
I can tell you the actions he has taken, his team has been on it.
He did what a president's supposed to do.
There's spirit in our country like never before.
They're doing things that have never been done before. This is record time for the development of a vaccine.
The one that really deserves the credit are the American people.
We're going to get through this and come out stronger than ever before.
My message is to all Americans, we love them, we're with them, and we will not let them down. I'm Donald Trump, and I approve this message.
Welcome back to American Heroes. Joining me now is a very special guest. His name is Martin Amy. He's a 4th generation sheep and cattle rancher in Northern California. Thank you so much for joining us, Martin.
Oh, thank you for having me.
Yeah, when we spoke yesterday, you said something really interesting, and it's common sense, but you said people have to eat, so we have to keep doing what we're doing. So while I'm social distancing in my home, you're out there, your workers are out there. Tell me about what you guys are doing, and thanks so much for keeping our food supply going.
Sure. Well, as a farmer and rancher, we're still doing our thing out here, producing food for the country and the world, really. And people still have to eat, so we're still doing our thing, and I do a lot of direct marketing into the San Francisco Bay Area and Napa Valley and Sacramento, and so we're still delivering food into those areas and trying to be as safe as possible and practice the social distancing and washing after every delivery but we're still out there doing our thing, and I just like to say thank you to President Trump for supporting farmers and ranchers all across the country and acknowledging us in agriculture as to how important it is. And it's just nice to know that someone at that high level recognizes us, and it's a motivating factor for us to know that someone like that is still kind of has our back and appreciates what we do.
Absolutely. I can tell you firsthand that this president has such a deep appreciation for agriculture and our farmers. I'm so glad you feel that, because it certainly is the case. Yesterday, in fact, just during the coronavirus briefing, a few days ago, actually, he said, China had $250 billion in purchases that they'll be making, a big win for the American people, about $50 billion of that for our farmers. He's done an extraordinary amount for our farmers. What do you think of how he's treated farmers from a policy standpoint?
Oh, he's done a tremendous amount. Unfortunately, with this COVID-19 thing, having to shut the economy down, those policies were working, and I believe they're going to have a dramatic effect when we open the economy back up to get agriculture in particularly up and going with the phase one China deal, opening up markets in Japan and the European Union, the USMCA with our partners there. He's opened up all kinds of markets that we really take advantage of when this thing gets opened up. So I'm really looking forward to that. I'm very optimistic that that's going to have a dramatic effect on the ag economy in particular.
Absolutely. It certainly will. His trade deals are really winning for the American people, our farmers in particular. What do you think of his response to the coronavirus? Because you are, a small business owner in addition to being a farmer.
Oh, I think he responded appropriately, and I don't think we could have had anyone else better in charge than President Trump with shutting down the travel ban from China and putting all of the CDC guidelines in place and putting these policies in place when he did, I think has had a dramatic effect on saving lives and keeping this pandemic at a minimum if that's possible. So without a doubt, there's no one else better in charge to be in charge of this situation and especially the economy. Means that we when this thing gets over and we get started again, there's nobody better in charge to put these policies back in place and have the economy grow like it was before.
You're exactly right. Like President Trump said, I made this the hottest economy in the world one time. I'm the person to do it again. And that's so true. Martin, thank you so much for taking time out of your day to join us. And thank you, all of our American heroes. We're holding all of you close to our heart. We're praying for you. God is with you. And we love you at the Trump campaign.
America is being threatened by an invisible but deadly enemy. President Trump is leading an unprecedented response to this threat, making the tough call early by banning travel from China and coronavirus epicenters, declaring a national emergency, mobilizing scientists, doctors, and nurses to treat patients and find a cure, testing more people than any other country, investing billions of dollars to help develop a vaccine. And President Trump is putting American workers and families first by increasing unemployment insurance, providing paid sick leave, fighting for direct checks to families, and helping small businesses survive. Together, we will defeat this pandemic and emerge safer, stronger, and healthier than ever. Because we are America, the greatest country on earth.
I'm Donald J. Trump, and I approve this message.